Hi everyone, Ewert here with Everyday Kentucky for our journey around the Bluegrass with DG Gridley of Aging with Grace. And you've brought us over into Nicholasville at Bluegrass Hearing Clinic. Why did you bring us here?
Well, Amber, we're here at Bluegrass Hearing in Nicholasville because we're going to talk with Dr. Vanessa Ewert about hearing loss in seniors.
What do we need to be looking out for to know that we need to get that hearing tested?
You know, just in general, are you struggling to hear in a noisy environment, a restaurant setting, groups environments? Is the TV volume creeping up? Is someone else saying, hey, can you turn that down a little bit, but you feel like it's at a comfortable level? Hearing over the phone, so you can't see someone over the phone. It's a little bit harder to communicate over the phone and you're only using one ear, so sometimes, or if you're having to switch ears to hear better. Tinnitus, that ringing in your ears, is a big sign to come in and get a hearing test. Also, balance, falls, you know, if you're noticing any of those things. Or if you've been exposed to noise. If you notice any kind of sudden change in your hearing, immediately call your doctor, your audiologist, your ear, nose, and throat doctor, somebody, because the sooner we can treat that, we can hopefully help save your hearing.
It could be something as simple as wax blocking the ears.
Yep, and that's what we start with that. You know, you make an appointment for a hearing test, but we always start with just looking in your ears and checking the health of your ear, the outer ear and the middle ear, before we even do a traditional hearing test.
I think a lot of people, they think, oh, I'm losing my hearing, I'm getting older, and their natural tendency is to just say, I'm going to ignore it.
Yes.
I don't want to get older, so I'm just going to ignore it.
Yeah.
But that's not the right course of action.
It's not. Most people wait like 7 years before they do anything about it. And sometimes at that point, it's just gotten to a degree that it's harder for us to help you. But if we start the treatment process sooner, the better the outcome.
I don't think most people know that.
No, and sometimes, you know, we see patients of all ages. I hear a lot, well, I didn't want to admit it, or it made me feel old. Well, and I see people of all ages. Yeah. Hearing loss is not limited to just people that are aging.
So I know they do hearing screenings when you're a child. Mm-hmm. And obviously it makes a lot of sense, like we have that annual hearing exam once we get to 65, but we should really start much younger, right?
A lot of times in pediatricians' offices, they do screenings, things like that, or at school. But then after that, we're kind of left to our own devices to decide, okay, am I noticing any problems with my hearing? Obviously, then get your hearing tested. We know from research that our hearing is as best as it's ever going to be in our 20s, and then after that, it does start to decline some. So even if it stays within that normal range of hearing, it's still starting to shift some. So it's always good to get a baseline hearing test. I would say starting at 30, 35, go ahead and start getting a baseline so that if you ever do have hearing loss, we at least have an idea of how it's going to progress and what it may look like.
Regardless of age, how often should you come get your hearing tested?
If your hearing is normal, if we do a baseline hearing test, we find that your hearing is normal, we recommend every 2 to 3 years unless you notice any changes. However, anyone over the age of 60 or 65 needs to have a hearing test